COVID-19 information session with Dr. Bharath Naravetla garu. Thank you all for taking time to join this session. So my name is Pawan. I'm the moderator for this session today. First, let me go through the agenda of the meeting. The first thing is what is going to happen is I'm going to give an introduction about our presenter, Dr. Bharath garu, and followed by asking his input on the current situation. Meera briefing is Sir Bharath garu. So Atlane, we will give some background on what's happening and where we stand as of now. So Atlane, meerandaru questions kuda as we mentioned in the communication, questions anni kuda meeru chat window lo meeru publish cheyandi. I will be taking the questions and I will be asking the questions to Dr. Bharath garu. So for the efficiency of the session, all the participants will be muted. So if you have any question, again, the only way to reach out is through the chat window. So first and foremost thing, I would like to make it clear that this session is only meant for information purpose only. And if you think if you have to do any action or any necessity from your side on in the aspect of what is happening currently, you are advised to contact your current medical practitioner to whom you're tied up with. That's one thing which we like to make it clear upfront before we start the meeting. So this is just purely an information basis only. That's one thing. And coming to the first agenda, Dr. Bharath garu. First, let me introduce Telangana Development Forum Canada, which is active, which has been very actively involved in various community activities in India and Canada and elsewhere. Took this initiative, and thank you very much, Dr. Bharath garu. So, being a part of the frontliner in the current situation of the COVID-19 and being part of various bodies of disaster recovery teams, we're enta busy untaro memu uhinchukogalam. So you're spending your Sunday with us means a lot for every one of us. Instead of taking rest and spending with family, as usually Miru, being a community contributor, Miru, ee session ki Miru raavadam, it's a great honor for us. So Dr. Bharath garu is from Hyderabad, Telangana, and he's been in US for a long time and doing medical practicing. And apart from his profession, he's very passionate about community activities and is very much he also involves in action and drives the community activities. And that's one thing. He even came to Canada to attend a lot of events organized by TDF Canada and supported us and encouraged us, which he's been doing. Thanks a lot, Dr. Bharath garu. So the next thing is going to be giving the overview of the current situation by Dr. Bharath. So I hand it over to you, Dr. Bharath garu.
Thank you, Pawan. That's a rather very generous introduction. First of all, I would like to start by thanking the frontliners, which includes the the law and administrative officers on the streets, emergency response teams, and the frontliners in the hospital and the administrators who are in the front line. And then I thank TDF Canada, Pawan, Srikanth, and other people for arranging this. As you are saying, Pawan, this is a very friendly talk. This is just a friendly question and answer session. And these are my opinions only. And for any medical necessity or any for further authentic or real need, I advise you guys to please contact your healthcare provider. And the information is correct as of today. The reason why I say as of today is when I did the webinar last time and the webinar this time, there is so much more information we have learned about COVID. This is an evolving virus disease, and we are learning new stuff every day. And the complications or the the pathophysiology, the way the disease is unfolding is very complicated and complex. So information is as of update up to today, and I can provide more updates later in the time. With that, I'm ready to take the first question, Pawan.
Yeah. So what is the latest information that is available on this about the lockdown? So the first question is people thinking that what is going to happen after lockdown? Like there's a common understanding or a perception that after lockdown everything is going to get normal, the virus is not going to spread, so we can go and do our day-to-day activities as usual ani anukuntunnaru. So you want to get a picture of our post lockdown.
Sure. Lockdown is not to eradicate the virus, meaning like we are not going to kill the virus or eliminate the virus from the community. Lockdown is only to slow down the disease progression in the community. So what I say is the infection or the immunity of the community have to happen, whether it is by the infection or by the vaccine. It is going to, according to WHO estimations, way back in January itself, when we didn't know much about the disease, we estimated that 70% of the global population will get infected with the virus. What it means is not everybody is going to have the disease or have the problems like symptoms from the disease, but they do get infected. Majority of them are going to develop the immunity, and probably majority of them will never show any symptoms that they got the virus. So I'll give an example of H1N1, which is a swine flu, which happened in 2009. We all know that initially we were like really worried, and the estimation started coming up, and we thought the mortality from the virus at that time was in 30%, like every third person was dying in the beginning. And few months into the disease, I'm talking about H1N1, 2009. Few months into the disease, what we learned is the virus is not killing so many people. The only people who are sick enough are coming to the hospital, and those are the people who we are testing for the virus presence, and then declaring that, okay, these are the people, number of people who got infected with the virus, and these many people died. And that number slowly started coming down. Once the pandemic ended, the H1N1 pandemic ended, and the numbers actually came up staggering, like estimated that 1.4 billion people were infected with the virus, and 570,000 were dead from the virus, and which like reduced the mortality by 65 times. The rate of mortality, what we talk about every time, like whenever we see a disease, oh, how many people are going to die from this disease? That is the most concerning thing. If somebody gets a virus, it is not going to kill them. It's only going to give like a few symptoms. Nobody bothers. Concern starts like escalating when the virus starts killing the people. So same thing is going to happen with this COVID-19. Initially, we thought the mortality is about 6%, 7%, and it slowly started coming down, and it came to 2.6 by WHO estimations worldwide. And then, in fact, now we are testing more and more people. Even the people with the mild symptoms, previously we were not able to test them because lack of availability of the test kits. Now we are going to test all of them. So once we test all of these people, these are not going to have major symptoms and die from the disease anyway. So the denominator, the total number of confirmed COVID cases is going to increase, and the numerator is going to be relatively stable. So that brings down the ratio of the people dying. So mortality rate or a death rate from this virus is going to come down eventually. How much it is going to come down, we do not know that yet. So now coming back to, with this introduction, coming back to your question of what will, okay, well and good, we did the lockdown, and after the lockdown, what is going to happen, right? So The lockdown is not going to eradicate the virus. Whoever the naive, virus naive people, meaning the people who have never get infected with the virus, once they start coming into the community again, if there are few people around there who still carries the virus, these people can get infected. But this rate of transmission is going to be much less than what it is going to be if there was no lockdown. The lockdown, probably you all guys have heard, flattening the curve. We always talk about flatten the curve, flatten the curve. How are we going to flatten the curve? You know, by isolation, by social distancing, by the lockdown. So the concept of that comes into picture because of two factors. One is the R naught, which is the how readily the virus can infect the next person. Let's say one person is infected, how many people it is going to infect in the next cycle, right? So for the seasonal flu, which we all know, it is going to infect, the R naught is 1.3. So in one cycle, one person infects 1.3. In the two cycles, that 1.3 infects 1.3 again. So it's a 1.7. So it takes like quite a few time before the virus can infect so many other people. Whereas COVID, initially we thought the R naught was 2.6 to 2.9. But the latest studies have proven that, you know, the R naught for this virus is almost, it's almost 6, you know, one estimation 5.6, meaning one person, infected person, can potentially infect 5.6 persons next to him. So with that, you know, once the lockdown is like lifted and when everybody starts coming into completely normal lifestyle, then we are going to see the cases. There is no doubt about it. But the hope is, or the good news is, we already know there are various treatments available. Some of them have a 80+% cure rate, and some of them have a 60% cure rate. And we understand so much more about the virus at this moment. So even if some people come with the infection, once the lockdown is lifted, I mean, the more people come down with the infection, the healthcare facility is capable of handling them in a much better way than what we were able to like 3 or 4 weeks ago.
Thank you, Bharath Garu. So in continuation to this question, so current treatment, so the people who are already got infected, what treatment are they getting? And ఇప్పుడు మనకి ఉన్న ఇప్పుడు ఇన్ఫర్మేషన్ ప్రకారము చాలా మంది కొంత మలేరియాకి సంబంధించిన మెడికేషన్ ఈజ్ వెరీ హెల్ప్ఫుల్ అంటున్నారు. సో ఆ పర్స్పెక్టివ్ లో దట్స్ ఆల్సో దేర్ లాట్ ఆఫ్ ఇన్ఫర్మేషన్ గోయింగ్ ఆన్. సో మీ ఒపీనియన్, మీ ఇన్పుట్ ఏందండి ట్రీట్మెంట్ లో పర్స్పెక్టివ్?
Well, Pawan, the treatment depends on how the symptoms are manifested. Okay. So there are like people are staging the disease. Like once the COVID virus infects, the coronavirus infects the person, then the patient can be graded into like a different stages once they start exhibiting the symptoms. But good news is, it is estimated that even from China, China reports themselves say, Wuhan reports themselves say, 80% of the patients who got infected with the coronavirus never had symptoms. And the latest studies showing that almost up to 94% of the people are not going to exhibit any major symptoms. So even if you get the coronavirus, you're not going to have major symptoms. That's a good news. And then coming to whatever 10% or 6%, these numbers are going to keep changing. So I may say a number today, it is going to change just within few days, because more and more people are getting tested and this denominator is going to increase. So these percentages keeps changing. But the bottom line is more and more people are like not exhibiting symptoms, and they're like, you know, getting away with the immunity naturally. Those people, like 10% or 6% who is going to have the symptoms, almost 60% of them, they are going to exhibit milder symptoms, not the major symptoms. Only 40% of them are going to end up requiring hospitalization and going into the ICU and stuff like that. So the treatment depends on what they are going to exhibit, right? So if someone has a mild symptoms, no major issues, then most of the hospitals have the protocols to give hydroxychloroquine. As you were saying, it is a malaria drug. And then in combination with other things, some people are giving zinc supplements. Some people are giving azithromycin, which is a commonly used for community-acquired pneumonia. But it is also shown that it has some antiviral activity. So people are clubbing both of them and giving to the patients. Once the patient gets into the hospital, that is a different story. All the people who does not require the ICU admission are everybody in the ICU. At least, 99, I want to say 99% of the hospitals in the country have the protocols to use hydroxychloroquine and azithromycin by default. There is no doubt about it. Even though people are like saying, oh, it is not approved by the FDA, and there are like contraindications and adverse effects, side effects, still, most of the people are getting it, even when they get into the hospital. The real problem comes in once the patient requires ICU admission, meaning critical care admission. That's where the whole drama is happening right now. So unlike other viral diseases, this virus is killing the people way more rapidly. And not only that, we were unable to understand what is the mechanism by which it is causing all the complications. So it is affecting the persons like not just one system, not just lungs. It is affecting multi-organ. So it is resulting into multi-organ failure, what we call it. So it affects like a heart sometimes, it affects like a blood, it affects kidneys, and some people are getting affected in the brain. And all these things are happening. So depending on what we are dealing with, definitely if a heart is affected, we got to take care of the heart. If the blood is like hemolyzing or clotting, then we have to, if the blood is clotting, then we have to use the blood thinners. These are all the system-based or symptomatic treatments are definitely in there. But one of the major thing which is like, we realized in the last few weeks is, some of the antiviral medications, antiviral doesn't mean if it was used for HIV, it doesn't mean that is a HIV medication we are using. It is an antiviral medication which we used for HIV. Now it also can be used for, COVID-19, something like that. Remdesivir, some of my colleagues call Ram Desi Veer, just to be, give the Desi touch to it. Is shown that it is effective in 60% of the patients who are in the critical condition. And one of the most, the data is not published out there, but having seen these patients like on the bedside and having given this, in the ICUs, I can say that convalescent plasma, the plasma or the serum from a person who already have the immunity. Let's say someone gets the virus and they get the immunity, meaning like symptoms are gone and the body has killed the virus. Those people develop antibodies. So if you take the plasma, meaning the blood without the RBCs and WBCs, the cells, only the antibody portion of it, liquid portion of it, and you can give it to other patients. If you give that, there is a very good response we have seen in the last 2 weeks, especially. So that's one of the hallmark in the treatment of COVID-19. So basically, the treatment for COVID-19 depends on what stage they are in, and how bad are the symptoms, and what is their requirement.
Thank you, Bharath garu. So one question around vulnerability. So is there a certain ethnic group which is more vulnerable than the other group? And also like because you're a frontliner and you're seeing a lot of patients. So is there a trend going on in terms of who is vulnerable and who is not vulnerable? And also the most important thing is the people who have less immune, they're more vulnerable, obviously. So immunity in the sense like if they have any pre-existing conditions with respect to diabetes or heart disease or heart disease or anything which makes them have less immune, they're also more vulnerable. We understand. So in that aspect, what is the trend going on?
Okay, before I answer that question, let me try to bring up the slide which contains that so that I can share with you. I hope I had it here. Okay, that's a good question. Let me share my screen right here. Oh, Srikanth, can you enable me to share my screen?
Yeah, just give me a sec, Bharath. Just a sec. I'm just trying to.
That's fine, Srikanth. So Srikanth is trying to enable that. See, your question was, who are the people who are likely to get the disease? Is that right, Pawan?
Yes.
So, we all know the people older the age, more likely that the people can get the infection. That's the number one. Number two, the more the medical problems they have, more likely they get the disease. That's number two. Number three is less immunopotent, or if someone is immunocompromised, then they are more likely to get the disease because their body cannot fight the virus. Okay, this is the general principle. And now let me see, I want to show that.
Can you try now, Bharath?
Yeah. Can you guys see that, my screen?
Yes.
Okay, this is reported from China. A lot of the data out there is like mainly from China and Italy, and new data is coming from France and Spain. American data is like still in a bit of a preliminary stage. Not every details I know more data because I sit in a DRT and DHSS meetings, but I cannot give out the data to you guys. So as we are seeing, look at this cardiovascular disease. When we look at it, it is when compared to no health condition, the number of people who died, percentage of the people who died with no health condition is less than 1%. Whereas the cardiovascular problem, meaning any heart problem they are almost 11 to 12 times more likely to die if they get the disease. Okay. And the same thing, diabetes, if they get the disease, their risk of death is 8 times, see 0.9% to 7.3%. Same thing, chronic respiratory diseases like a COPD or a cystic fibrosis, any of those diseases, people are more likely to die if they get the disease. Okay. Not only that, people are more likely to get the disease if they have these underlying medical problems. I cannot tell you at this moment, what is the percentage risk or likelihood, relative risk we call it, to get the infection, because the denominator is significantly changing, right? So we don't know how many are let's say how many of the cardiovascular disease patients are likely to get the infection. We don't know. There may be like thousands and thousands of out there with the cardiac problem, but they may not have any symptoms from the COVID now. So all these numbers will come out like once the pandemic is over and we start checking the antibody test, meaning check the blood and see if they developed antibody to the virus, meaning they might have had the virus at some point of a time and they got the immunity for that virus.
Thank you.
And I just want to touch upon there. One of the other things, the mortality wise, right? So you asked who are like more likely to die or get infected. So the males are getting more infected. That's number one. And males are like dying more than the females at this moment, even the ratio wise. And race wise, if we talk about the ethnicity, African Americans, unfortunately, are more likely to catch the virus, or maybe everyone is catching, but they are more likely to get the severe symptoms from the virus. And they are the ones like with a higher percentage of a death rate. So when we look at all-come data, actually I think I have a slide for that too. Let me see. Let me try to get that slide. Unfortunately, I think I misplaced the slide. It is somewhere in my desktop, but where I don't know. Okay. Anyways, I had all these numbers lined up to show you guys. African Americans are dying. When we are looking at the numbers, the total number of mortality, like in the belt where the African Americans are more in the population and more concentrated, the percentage of the people dying from the COVID, they're sometimes reaching up to 60-70% in some of the hospitals. So if 100 people die in a hospital, 60 to 70 of them are African Americans. When we look at the United States, I can mainly talk about the US guys. I know it is the TDF Canada organizing, but more data is available in US at this time. So let me stick to the US data, which is going to be pretty much same in the Canada too, in the same ratio. So when we look at all cause and all over the US, 40% of the mortality, people who are dying are the African Americans, 40% are Caucasians, and the remaining 20% are like Hispanics and everybody else. So for the percentage of the population the number of people who are dying are way more. So that's an unfortunate situation. The reason for that, we do not know that yet. Whether, they have some kind of a genes where the viral receptors are more expressed on the cell. So when the virus come in contact, they get infected really quick. Or is there some kind of a underlying, baseline medical condition where when they get the disease, they get the more severe symptoms? We do not know. Other thing is, one thing for sure we know, that most of the population, the African American population, they have more medical problems, underlying medical problems. Probably that is not helping either. So these numbers, we have to look into it more carefully and understand why there is this disparity of disproportionately killing more African Americans compared to the other races.
Thank you, Bharath. The reason I asked this question is there is an opinion among some group of people that, for example, if you take people of Indian origin, so we must have already undergone these virus related diseases during our childhood, and it's one point of time. So we have built immune, so we really don't need to worry. And also the people in India also thinking because of the climate, the virus will not spread unlike in cold places. So these are some things which are going on. So దీని మీద కొంచెం మీ 2 cents can you throw?
Yeah, it's an interesting thought and interesting observation. So far, what we are seeing is the number of people getting infected with the virus in the Indian community is on a lower side. There is no doubt about it. And the percentage of the people who are progressing to severe symptoms is also on a lower side in the Indian community or the Indian origin. Not only India, even in US, the number of people getting infected with the virus may be high, but we don't know, but they may not be exhibiting the symptoms. But in the hospitals, when we look at it, the percentage of the people getting admitted into the hospital, the Indian community there is less percentage. And the people who are dying once they get infected, there's also the percentage is very less among the Indian origin. So do the Indian community have some genetic immunity towards the virus? It is a possibility, we don't know. But the general trend is when there is a more of a non-viral diseases in a region, like a parasites or bacterial infection, the viral infections tend to be on a lower side. Whereas in the countries, most advanced countries, like example, Canada and US and some of the European nations, where the bacterial infections and the parasitic infections are on a very lower side because of how much they use the sanitary techniques and everything. Those are the places where the viral disease on a higher side. Is it because of the lifestyle? The viral diseases are more in America and North America compared to India. We don't know that yet. One thing is now there is new theories coming up. New theories that people who got the BCG vaccination. BCG vaccination is the vaccine for the TB. People who got the BCG vaccination, they have some immunity towards the viral diseases. Not just COVID. It's not just COVID, but in general, like any of the viral disease. And that's one factor which is looking into. Second thing is the usage of the hydroxychloroquine. There is so much more we are learning about the hydroxychloroquine now. We used to think that hydroxychloroquine is only used for malaria, but not anymore. And when we started using hydroxychloroquine way in the beginning of this problem, we thought the hydroxychloroquine is going to help the people by two mechanisms. And then we learned the third mechanism. Now we are learning the fourth mechanism by which it is going to be helpful. And now there is a theory that, hydroxychloroquine, the immunity which is conferred by the hydroxychloroquine is long lasting. It's not just like, during the disease process, you give the medication and then, everything is like it works only for that period of a time. Actually, it is not. It is actually working even, it is postulated, or it is at least like thought that, this is going to confer some immunity on a long-term basis. Is that a reason? Most of the Indian community in India, if not now, malaria is not that prevalent, but in the past, I think pretty much anybody who is like 30 years or older, definitely they might have gotten hydroxychloroquine treatment at least a few times in their lifetime. So is that giving some immunity? It's a possibility. And then this new theory of we use so many spices in our food, and the way we eat the food is like we cook thoroughly, and it's spicy and all that. Do the spices confer some antiviral property? Is it going to give some immunity towards viruses? It is also a possibility because we all know, turmeric we use, ginger we use, and lime, which is we use a lot. All these have some antioxidant properties, antiviral properties. They are the immune boosters, and they also provide some antioxidants. So combination of all these things, what we are observing right now is COVID-19 is not affecting the Indian people, Indian community that much as it is affecting the other people. It was also proven, multiple times when we go back to the sister of COVID-19. This is we call it a SARS-2, severe acute respiratory disease, what we we had in 2002 is also caused by coronavirus. And it was also a coronavirus type, pretty much similar to what we are seeing right now, causing the COVID-19. So we call this a SARS-2, or we call that one as a COVID-1, and this is a COV-2, COV-1 and COV-2. We know from that data that it has not affected Indian community much, especially in India. There are not many people who got infected with this virus. I'm not talking about COVID-19, I'm talking about previous coronaviruses. Whether you take an example of SARS, or you take an example of H1N1 also, the swine flu, the percentage of the people who died, it definitely infected India too, Indian community too. I'm not saying they're 100% immune to it, but the percentage of the people who died from these viruses in the past is on a lower side. And the hydroxychloroquine, the good thing about the hydroxychloroquine, we learned that some of that things from the past viral infection. We learned it from SARS virus. Hydroxychloroquine did prove beneficial in SARS virus, which is a sister virus of younger sister or elder sister, you can call, of the COVID-19. So in general, Indian community is a bit more resistant to these viral infections, and they are less likely to develop the severe symptoms. Their risk of dying is lesser compared to the other populations.
Thank you, Bharath garu. So manaki participants tarafuna questions vastunayi. I'm making a note of all the questions. So before we go to specific questions posed by various participants, let's wrap up the generic questions. So the generic questions, the answers what you're giving also answers most of the specific questions as well. So the next generic question is, so if I had coronavirus in the past and unknowingly, or I'm not aware about it, and is there a test in the future which will say that I had coronavirus in my life?
I think I covered it in a nutshell previously, but I'm going to answer that again. That is where the antibody test is going to come into effect. So there are two types of antibodies, which are IgG and IgM, and one is like goes up when the infection is current. The other one goes up, which confers the long-term immunity after the virus is cured or eliminated from the body. So this antibody test was not available until April 3rd or 4th, I would say. And after that, FDA has approved at least 2 companies I know of which can do the antibody test. Now we have it in Michigan too. And I can't comment about the Toronto or other Canadian cities if the antibody test is available, but I would not be hesitant to say it would be available in the major cities in there. So this test is going to tell you if you have an immunity, meaning if you have antibodies against this particular virus. So once the test is available more abundantly, everywhere, easily, then people should get tested. The WHO has a clear recommendations and a strategic plan about how to act in the pandemic diseases. It's nothing new. Pandemics were known to humankind for centuries, from hundreds of years back. So they have laid out a nice plan, strategies. Are they going to be exactly work 100% every time? Probably not. But the way to deal with this is, the last thing we want in any of the hospital is a patient dying because of lack of hospital bed or lack of medical care. So that is why we always, when we talk about that curve, which we always talk, right, the spike Reinshet and the slow sigma curve, we need to flatten the curve so that the healthcare facility is not overburdened acutely, and it gives time for the healthcare to take care of the patients. That is because it is inevitable that everybody will get infected. That is for sure. If not today, And I want to say, having like following this disease so closely, sitting in so many meetings and talking to so many experts across the globe, I want to say that there are millions and millions of people already infected and they have the immunity from this virus. It is just a matter of time. We need to do the blood test and find out who are all these people who have the immunity already. It is only the caution that, we don't want to get infected without knowing and overburden the healthcare system so that we suffer because of not because of the lack of healthcare to the pandemic, lack of facilities towards the pandemic. So WHO has a clear pattern. One of the pattern is like, you do the isolation, lockdown for 2 to 3 life cycle, the infection cycle intervals we call it. So one person getting infected to the second person, and then that person gets the next ring of people. So it is expected that the cycle intervals for the COVID virus is 7 days. So if this person is infected today and that person is not come close to anybody for 2 weeks, the two cycles are done. The third cycle is started. So actually it is a three cycle intervals. And then also the incubation period. This person infected today can infect anybody else generally for 14 days on COVID with the COVID-19. So for that 14 days, you keep the isolation, it's gone, right? This person cannot infect the people surrounding it and he has the immunity. So the virus source is gone. Now you wait a couple more days and then lift the lockdown and let the people come back in and see if there is any, and then institute the lockdown and then see for the next 2 weeks if there is any surge in the cases. Okay, if there is a surge in the case, what it means is there is a still virus out there. People are not, we call it a herd immunity. Everybody needs to get immune with this virus. So there is no herd immunity. So the people needs to get infection or the vaccine before they can start flooding the hospitals. That's one way of doing it. So then you lift for another 5 days, 7 days, and then lock down 2 weeks and see. But when we do this, sometimes the things go out of control because, the R0, which I was explaining before, the number of people who can get infected with this virus is like, it is going to be tremendous. A lot more people can get infected, like 6 or 7, or even some people are saying 10 people. So if that happens, all of a sudden you may lose the control. That is why the countries like India and America and any other country for that matter, they are extending the lockdown because there is still an uprise of the viral cases. That's one way of doing it. Other way of doing it is once we get the antibody test, this is the plan for America and Canada or even Germany right now. You check the people, frontliners especially, and see who are all the people who have the immunity and let them into the field. Okay, allow them to go and get the normal routine started, and you check more and more people and let the more and more people in. So the things will get started and life goes on, and slowly more and more people will get in, and eventually we get to the normalcy.
Thank you.
But this virus is like a completely different beast. I have to say that. And which direction we are going to end up, I don't know. It is too soon, and it is not going to be like a flu, or it is not as easy as previous coronaviruses like SARS or swine flu. It is going to be more rampant than that.
Okay. Thank you, Bharath garu. So related question endante, we are hearing that COVID coming back after recovery. South Korea reported some cases. So when we build immunity, why is it coming back?
Okay, so we have to be careful in understanding what these reports are, what the websites are reporting every day. I myself see that the data we release is is taken up by these websites, and how the data is misinterpreted and how they are represented is different, and how the people are misinterpreting that data is different. So we got to be very careful in understanding this data. So a lot of data keeps coming, and there are so many websites which keep reporting in a different formats, case fatalities, rolling 3-day rolling averages, and the total number of daily cases, and all these things. I advise caution in interpreting this data. The reason why I say that is, for example, let's go back to the South Korea example, right? So South Korea has instituted the lockdown, very good lockdown. People the moment they realized that there is one city infected, they shut down the entire country and they did not let people come in contact. So where is the immunity for the people? There is no immunity for the people, right? There is no vaccine right now. If you lock down the people and give the vaccine to everybody who is in a lockdown, and then let everybody come into the common circle, like, normal lifestyle, then they're not going to get infected. But if you just lock down everybody, and then once, after 2 weeks, 4 weeks, 8 weeks, 12 weeks, you let them come into normal lifestyle, they're going to get infected because they don't have the immunity. So the herd immunity is not there. So the people are going to get infected no matter what. It's a matter of time. It's a matter of time. So what happened in South Korea? Same thing. They locked down. Now the people are slowly coming into the normal lifestyle, and they're getting infected. And it is not too terrible either. That is one way of dealing with this deadly virus. It is a very deadly virus. It is not I have to say, I have not seen anything like that, like this virus in my lifestyle, in my lifespan, for that matter. I've seen so many diseases, and I do different jobs. One is interventional neurology and and the second thing is neurocritical care. I also do the critical care. So, and I'm medicine and neurology and trained and board certified. There are so many different diseases I deal with, but I have not seen anything like this. And I still have so many unanswered questions about this virus. So naturally, once the lockdown is lifted, people are going to get infected. So that's for sure. That's what is.
One of the question is the people got infected and recovered, the chances of getting infected again. That's one question.
It's an excellent question. Actually, it is a very loaded question. The reason why I say that is, it is too early to say with 100% certainty. But the thing is, there are reports from China. Okay, people who got infected previously got immunity, they got reinfected. So there is a chance if someone gets the infection, get treated, or get immunity, they still can get infected. The reason for that is very simple, which is usually let us take an example of flu virus, right? Common flu we get every year. We have a virus vaccine. We get so many millions of people get infected. Estimated that in North America, there will be 60 million people get infected. Probably 100 million people get infected, never gets any symptoms or anything. We don't know that yet. But at least the data which suggests 30 to 60 million people get infected with flu. Okay, there is a vaccine. There are so many millions of people, they get vaccinated every year. But every year, once you get the flu, there is no guarantee that you will not get it next year. The reason for that is very simple. Viruses are RNA particles or DNA particles. There are few DNA viruses too, but most of them are mRNAs. So they are very smart. They cannot live without a host. Outside, they cannot live. They have to have a host. So when the host is trying to kill it, it is very clever, and it changes its genomic structure. The gene structure, they change a little bit. And to appear as if they are not the ones which have infected you in the past. So we call it a genotypic variations. So in a typical year, when there is a flu is going on, in a typical year, there is usually 40 to 50 variations. In a bad year of flu, you will get 200 plus variations, 200 to 250. Compare that to COVID-19. What we are seeing is Wuhan itself has reported 200 plus variations. And by the time it entered into North America, we have already crossed 1,000. And the latest report by, last week, 1,200 plus variations are already reported. These are small variations, but these are variations. What is it telling? This virus is very smart and it is mutating, changing its genetic structure very, very quickly. So if you take example of a person who got infected with the very first variation, the very number 1 variation, got immunity, now come in contact with the 1,200th variation, the one which changed drastically. His body may not recognize this as the same COVID virus which he got infected. So it is a possibility that he can get infected with this latest virus again. That is why I was saying in one of the meetings I attended, a lot of COVID experts in the meeting, and I said this is going to become a seasonal problem for us. Everybody this is, I'm talking about not now, I'm talking about about a month ago. And people criticized me very well and laughed at me. But now they're all agreeing, oh, it is a possibility, it is a possibility. And then New York Times and the WHO has reported, it is not over yet. The virus can come back next year, may come back. They are saying may come back. But I am saying it most likely will come back.
Thank you, Bharath.
We may end up like a flu virus. So, or at least, I'm hopeful that, it does not end up like a regular flu virus. I'm hopeful that it may end up like something like a SARS virus or bird flu virus, where it comes back next year, but much less number get infected and much less severe symptoms are manifested with that. I'm hopeful of that. And I pray God, I pray everybody that this does not mutate to become a more virulent, meaning more dangerous virus. When the virus is mutating so fast, there is always a danger it can mutate and it can make its virulence more, and then it may start killing more people. I'm praying God, honestly, I'm telling you, this is what I pray every day. I hope this virus does not become more deadly than what it is right now.
Thank you, Dr. Bharath garu. Hope your prayers come true. Hope your prayers are answered. We all pray. We are also praying for the same. And the question, let's get into the topic of vaccination. So a lot of questions post-Jason or vaccination by now. So vaccination a stage lo undi. Okavela vaccination vachina, will the vaccine address the source and also the variations what you mentioned? And again, it's vaccination process also ongoing. So let's can you please throw some light?
It's a dynamic process, Pawan. It is very hard to say if vaccine is going to address all the variations. Probably not. Does the vaccine address most of the variations, almost 99.99% of the variations? Yes. And we may have a vaccine today with every single strain of the virus there. But this virus is mutating so fast. By the time the virus is produced and come into the market, and the people get the virus, there is a possibility that it might have changed a few hundred times already. So it is all logic. It all depends on how much genetic similarity we are going to achieve with the vaccine. And is the vaccine ready now? No. The reason is, yes and no, actually. People have prepared the vaccine. There's no doubt about it. All you need to do is you need to identify the the viral structure and make the similar antibody to it, or the pick up the antibodies which are there and use the genetic recombination technique and then start multiplying it and make an antibody or something like that, which is less potent or which does not have a capacity to kill the cell, but make the cell activate so that it produces the antibodies in the body. So make a viral particle which is similar to what we have and give it to the people who are not infected, hoping that it does not cause problems. But the problem with this is you do not know how this viral particle is going to behave if you give it to a normal person. See, right now the estimations are 6% of the people are getting symptoms. Let's say you make the viral particle and you give it to the people. What if it causes the symptoms in 12% of the people? Instead of helping the people, you have actually damaged the entire thing. You have caused more harm than the benefit. So that is why every time a vaccine comes, it has to be studied in phase 2, phase 3 clinical trials. And then the randomized clinical trials where, you actually give in the community, you give it to selected half, and selected half does not get it, and then see what happens. So this all takes time. Usually the vaccine approval takes about a year to 18 months. Because you need to see before the approval, it gets approved. But on an emergency authorization use, we call it a EAU, FDA sometimes can, give okay to these vaccines sooner, but it's not going to be within 1 month, 2 months, or 3 months. It definitely takes about 6 months. And I'm hopeful that there are at least 7 people who are working on the vaccine, 7 different companies, which I know of, are working on their vaccines. I'm hoping that a good vaccine comes into the market pretty soon with a good safety profile. Safety profile is at most important. We talk about the flu vaccine. Flu vaccine, we make it every year. And all we need to do is change the new variations, that 40, 50 variations which come into, and so that the next, the body has creates the immunity for that. In spite of that, there are complications with the flu vaccine. So imagine a new virus like a COVID-19 coming into, people are hurrying to prepare a vaccine and trying to give it to the people who are not infected, who doesn't have an immunity. Then all of a sudden, if you find 100 cases of people where it is affecting, usually these things, most unforgiving things these vaccines do is they affect the brain. They affect the brain in a very, very different structures. I'm just talking about a flu vaccine. When it affects the brain, it is not pretty. The brain is the least forgiving organ in the body. Anything else in the body, it forgives you. There is a regeneration, you regain the function. But the brain cells, once dead, they are dead. Nothing comes back. So it takes time for the vaccines. And I'm hopeful as much as you are hopeful that it addresses all the strains, but chances of that, there is a small risk that it may not counter all the variations in the virus.
Thank you, Dr. Bharath garu. So, my next question veldamu. One of the participants asked the question about your findings on Israeli therapeutic medicine.
My findings on the medicine, I need to know what exactly they are talking about. I cannot just generally say that. There is there are companies from the Israel where they are coming up with the vaccine, and they are coming up with the different ways of fighting the virus. For that matter, every other country where the research and the medical field goes on, they're all studying it. It's not just one or two people. It's not just 1 or 2 countries. And all the countries in the world, they are trying to brace for the impact, and they are also trying to find ways to mitigate the virus. Other than that, I cannot comment anything just in particular about the Israeli therapeutic medicine. I don't know what they are talking about.
Okay.
If I get more details, I can comment more.
OPAGANIB is a medicine which says 100% cure.
It is too early. I heard about it. It is too early to say. One simple thing I'll tell you for everyone. There is no 100% on anything. The only thing which is 100% certain is death. Other than that, there is nothing in our life or in the universe which is 100%.
Thank you, Dr. Garu. So the next question, as part of mass testing, apart from whatever testing that are being currently given, thermal screening, do you think it will be helpful to screen large crowds?
No, it is absolutely not going to be. It is a screening tool to get to the next level to get tested, but it is not a screening tool to say that you don't have the virus. If you have a fever and other classic symptoms of a COVID, then it is helpful. But if you don't have the fever and still have the classic symptoms, it's not going to be helpful. It's a mass screening at this stage onwards, like a thermal screening is completely useless.
Okay. Thank you, Bharath Garu. The next question, what precautions the family member should take if one of the family member works closely with COVID patients? One of the family member is a frontliner like you.
I mean, see, it is a very difficult situation. You know, the frontliner like me should stay not with the family. You know, I thought about it. You know, maybe I should not stay in the same house as my family, but at the same time, I started taking hydroxychloroquine as a prophylaxis. At the same time, I take a lot of precautions. My family, my kids have not ventured out of the house. This is the 30th day, not even into the backyard. This is the 30th day. They don't go out. When I go to the hospital, I have 3 sets of scrubs. So I leave the scrubs there when I get in. I get into a new scrubs, new hat, and I put in the mask and go and see the patients. And then once done, I change the scrubs, come in and take an extra scrubs, come home. And when I come in, I leave the shoes outside and I go into the mud room, you know, the bathroom, which is right next to your door, and take a shower there and wipe everything what I touched before that. And then, you know, when I'm going next time, I'm taking the new scrubs and go in there. So for every visit, every on-call, what I do, I use 3 sets of scrubs. That's how I do it. Does it prevent the infection being carried to my house? Probably not. And in my opinion, my gut feeling is I already had it. I just didn't have symptoms. When I look back and look at the symptoms, I have pretty much every single one of them at one point of a time or not in the last 3 months. You know, some of the classic symptoms I had, and I don't know, for the sake of a group, I want to show the symptoms real quick. You know, unlike the flu, this is different, right? So let me bring that up. So what we are seeing is the COVID-19 symptoms compared to other common. You know, we see the common cold here, the flu here, and the seasonal allergies here. So fever is the most common thing. Dry cough, shortness of breath are the most common things in the COVID-19. This slide is, released by WHO way back, you know, but there are so much new things, you know, we learned in the time period that diarrhea, you know, watery diarrhea, watery stools is with a severe abdominal cramps is a symptom of COVID. Rashes of various types, unexplained, herpes zoster, we call it shingles, right? Chickenpox, the people who have chickenpox as a, kid, the virus may be dormant in the nerves. And when the body immunity goes down, the virus get reactivated. And when it gets reactivated, it produces, vesicles, like a small pustules on the skin, which contains the serum and all that. Even that is a symptom of COVID. And loss of taste sensation, loss of smell sensation is reported in 25 to 29% of the patients, meaning 1/3 of the patients who got infected with the COVID, they have loss of taste and loss of smell sensations. Nobody even pays attention to these. I treated 16 physicians. I treated 16 physicians with the COVID infection. Pretty much all of them have these non-specific symptoms. Only like 4 of them had shortness of breath and the dry cough. Majority of them had all the, non-specific symptoms. So what I'm observing here with the COVID is when people have like a natural immunity towards the viruses, they get the virus, they are the ones most likely is going to manifest atypical symptoms rather than, having shortness of breath and then unable to breathe and forming clots and stuff like that. That is the stage 2 and 3 of the disease. So what I'm saying is most of us who have the immunity so that the COVID does not get into advanced stages. They just get arrested in the preliminary stages. So all these 16 doctors recovered nicely. 2 physical therapists I treated recovered nicely. And so many other people. I can't divulge all the information what I treated, but so many other people, general people. And I also do the telemedicine COVID screening for McLaren now. I work for McLaren Healthcare, and we have a COVID screening there. And I also do the COVID screening volunteer work.
Thank you, Dr. Bharath garu. My next question వచ్చేసి ఇప్పుడు preventive measures మీద, let's go to the preventive measures topic. So as part of the preventive measures, మనము రెగ్యులర్ గా హ్యాండ్ వాష్ చేసుకోవడము, శానిటైజ్ చేసుకోవడము.
Pawan, before we go, can I just touch base upon the previous question? So frontliners unte vallu how the family should be. Typically, in the beginning, when like a month and a half ago, what we thought is mortality is 5%, 6%, and everybody getting infected, they are getting into the hospital, developing symptoms. At one point of a time, in the beginning of this disease in North America, we thought 60% of the people who getting infection are getting symptomatic and getting admitted to the hospital. So that's when it was more scarier. But it is less scarier now because 90% of the people getting infected are not getting any symptoms. That is an encouraging news for us. So taking this point into consideration, I feel more like safe or more, confident to come back home even after my, hospital rounds. Even when I get into the COVID patient, and it's known thing, right? If you enter into a COVID patient room, the virus is there in the air. Okay, you get it. There is no doubt about it. Even if I use P100 mask or the astronaut suit, still there is a chance that you get every time you get to the hospital. But I feel more comfortable now coming back home because number one, it does not affect the kids as much as the older people. See, the mortality from this disease, percentage of the people died from this disease is way, way less in the people who are less than 20 years old. It's a less than 1% mortality. Those reported toddlers and teenager cases, they have some underlying problem. They're not like a normal, healthy people. They have some underlying problem. So unless somebody has some underlying problem and they are especially more vulnerable to disease, you don't necessarily have to worry too much about it. as long as you take, general precautions. So I feel okay to come back home after my patient visits.
Thank you, Dr. Bharath garu. Next question around preventive measures. So ఇప్పుడు మనము హ్యాండ్ వాషింగ్, శానిటైజర్స్ వాడడము, మాస్క్ వేసుకోవడము, దీంట్లో కూడా చాలా ఒపీనియన్స్ ఉన్నాయి. ఎట్లా అంటే ఎనీ టైప్ ఆఫ్ హ్యాండ్ వాష్ విల్ వర్క్ ఆర్ ఓన్లీ యాంటీ బ్యాక్టీరియల్ హ్యాండ్ వాష్ వర్క్స్. శానిటైజర్ లో కూడా ఎనీ శానిటైజర్ వర్క్స్ or specific kinds work well and specific sanitizers won't work well, and same with masks also. We see people wearing handkerchiefs around the nose as well, and some people say that only N95 mask will work. So వీటిపైన కూడా కొంచెం మీరు అభిప్రాయం చెప్తారా?
This is important question for everybody, because there is a lot of logic behind what these recommendations are. Okay, mask, right? Let us come to the mask. Everybody should wear a mask. But does the mask prevent everything? It is not, because I want to say the virus is airborne. Not a typical airborne where it keeps floating. Virus itself keeps floating in the air. No. Let me show you a slide I got from one of the articles which I was reading a few months ago. Let me share this screen. You guys see this slide here? Pawan, can you see the slide?
Yes.
Okay, what this is showing is a cough, right? Somebody is coughing. Usually when somebody coughs, what happens is air droplets come out. Air droplets come out as we are seeing the larger, I don't know if you can see my mouse moving on it or not, mouse pointer. So it goes, the larger particles goes, and then regular breathing, some air droplets go up to like a 1.5 meters. And with the cough and sneeze, regular cough and sneeze, then it goes up to 2 meters. These are the droplets, okay? Then if someone has a violent cough, violent sneeze, sneeze is like a velocity is almost 50 meters per second. It is not a easy thing. When somebody has a violent cough, sneeze, the air droplets themselves, the droplets can go up to 6 meters. And someone was saying in one of our meetings that they have shown that the air droplets can go up to 10 meters, meaning 30 feet. So the regular 6 feet distance for any of these viral precautions is for a normal breathing and a normal cough, sneeze, and with the virus which is not so much virulent. And then imagine somebody sneezed and there is a breeze going towards in the direction of the sneeze. Then these droplets can carry even further than this distance what we are seeing here. Okay, that is first part of it. But there is a second part of it. When we are breathing or when we are sneezing and coughing, there are some aerosols, a minute, not usually seen by our eyes, the aerosols, which are less than 10 microns in size, which are forming. And these can suspend in the air up to 3 hours, 2 to 3 hours. So now come back to, okay, what is the virus? Where is the virus in most cases in a COVID patient? It is in the throat or nasopharynx or in the lungs or in the nose. And when somebody sneezes and coughs, the virus can get into these aerosols too. It's not just getting into the water droplets, but it is also getting into the aerosols. So once they get into the aerosols, they can float for 2 to 3 hours. Now imagine if there is a breeze, okay, 5 miles per hour, and there are aerosols from a person who is infected with COVID virus. These aerosol droplets, the aerosols can travel up to 10 to 15 miles. So, and these aerosols are not prevented by regular surgical masks. They are only prevented by N95 masks.
That's the first part of it. And the second part of it is, the virus is not just infecting the people by inhalation through the nose or through the mouth. They are also getting infected through the eye. So when you are wearing something, you also have to wear something on the eyes. So it is practically impossible to prevent 100% of the virus infection. And why aerosols are more important in COVID? There is a explanation. When we looked at the swabs coming out of the throat from the nose, nasopharynx of the flu virus, and compared that to the viral load of the people who have COVID, the COVID virus is present 10,000 times more than the flu. So there is so much virus in there. That is why the aerosols also can carry this virus, can contain this virus and carry this virus. So that is why there are so many people so rapidly getting infected with COVID. But having said that, lesser the number of viral particles come to you, less likely you are going to get infected. Is it a good idea to put a mask on? Is absolutely. I'll tell you why. More than it preventing you from getting infected, it prevents you, if you have a COVID, from getting infected the others. Mask work both ways. It is not only preventing the droplets coming into you, it is also preventing the droplets going out when you sneeze, cough, or take a deep breath. So mask is going to be really useful in fighting against this COVID-19. We all should use it. And on top of it, other precautions like, washing your hands and all these things, general precautions, good hygienist precautions, definitely. One thing I want to bring to your notice here. Virus is present in the stool in the people who have a digestive system involvement. It is present in your feces if you get infected. It is present in urine. Every single, body fluid has been found to have the virus so far, depending on where the virus is prevalent. If virus is like patient is having viremia. So when you use the public toilets or anything, or even if you are in the house, if someone is using toilet and there is like, they are frontliners or something, it is better for the other people to be extra cautious in using those, the bathroom stuff. That's a caution. And the other thing is, look at the the other side of it. Let's say someone has an infection. We all know COVID incubation period is 2 to 14 days. And now we are learning that the incubation can be up to 4 weeks. You may have the infection now. You may not have symptoms for 4 weeks, 28 days. And the people are shown to shed the virus. The longest reported case is 47 days. After the infection, people are still shedding the virus for 47 days and with no symptoms. So if a frontliner like me get infected and come home, it is almost certain that everybody else in the house get infected, because our filters are not completely HEPA filters. There is an exchange. It is not negative pressure rooms. Virus is there in the air. There is no doubt about it. I don't want to scare you guys on this, but that is most likely is the way the disease is progressing. On the brighter side, look at it. 94% of the people don't even know that they got the immunity already, even if they get infected. So we have to live our life, got to take precautions. And that's a mask is a must for anybody who is going out. Always wear it, at least until the pandemic is over. And then comes to, handling the stuff, comes mail and the stuff like that. Let me show you a video of the aerosol, actually. I usually want to show this to the people, This is a a video describing the aerosols. You know, when we sneeze or cough.
すぐに落下します。ところが、こう角度を変えて見てみます。小さく軽いため、には考えにくいと言います。だけでシミュレーションします。5分後、10分後。
So, you know, that's the video depicting, you know, aerosols. And then let me show you how long, one of the questions being asked more and more often nowadays is how long the virus survive, okay? Not too long ago, New England Journal of Medicine, you know, there is an article which came up. I'm not going to show you the entire article, but I can show you the slide from there, which is showing the survival. Okay, let me share this screen. And this has been, we know for the fact that, you know, virus do survive from the SARS-1 virus or the COVID-1 virus. We do know that it does survive for like 2-3 days, sometimes 70-80 hours. You know, but I want you to just pay attention to the lower part. See, this is the titers. How the titers are going to be, the above, the one in the red. Are you guys seeing this?
Yes, yes.
Okay. What we are seeing is these are the aerosols, right? You see the aerosols. See how the aerosols are like produced 10 to the power of 4, meaning 1,000 titers. Okay, 1,000 viral particles, and how it comes to 100 particles in 3 hours. This is COVID-1, COVID-2 virus. And the lower one, blue, is the COVID-1, which is a SARS, 2002 SARS. See, it is also the same thing. It is a little bit more present. This is less, which is a good news. On the copper, it can survive for so many hours, almost up to 18 hours. On the cardboard, it can go up to 50, between 50-60 hours. On a stainless steel, it can last up to 60 to 80 hours. So is the plastic, 60 to 80, 90 hours. So if the viral droplets or anything falls on these, you know, this is from New England Journal of Medicine, guys. It's not like anybody's guess or anything. So if the virus lands on these, it can still be alive for that period of a time. So, you know, handling these carefully, not like touching them and putting the fingers in the eyes or in the mouth or nose, or, you know, these things are not, these are strictly prohibited. That's first thing. And washing any vegetables or fruits before we eat is a traditional practice. Every, you know, from Indian culture, we are supposed to do that anyway. You know, the only problem is, you know, sometimes we get these prepackaged food and something, you know, if you put them in the, see, the other thing I want to say, once the temperature starts going up, the survivability of the virus goes down. Especially the viral survivability in the droplets goes down significantly, because as the temperature increases, you know, the droplets dry out quickly and then they die. Same thing with the aerosols. The virus cannot live freely for long in the aerosols as the temperature goes up. Especially exponential, it goes down exponentially once the temperature reaches 20-22 degrees. And for every 1 degree, there is up to 5% drop in the viral survivability, the duration of the time it is going to live. So that's a good news. Probably that is one thing which is like working in favor of the countries like India. And other thing is the way we cook the vegetables, or like anything, no virus will be survived in that way of cooking. You know, we cook thoroughly and we use all the spices and everything, so the virus won't survive. Coming back to what kind of a antibacterial or any hand sanitizers to be used, basically this is the virus. Let me see if we have I have a picture of that virus
I can show you the structure of the virus. I think I don't have it right now. Oh, you know what? Actually, I have it. So these are like spike proteins, S proteins we call it. You know, those are the ones which are protecting, and this is the membrane, which is protecting that inner RNA. So once this layer is gone, lipoprotein layer is gone, virus won't be alive. It becomes inactive and dies. So the soap, alcohol, definitely makes these viral particles ineffective. So washing with the soap, even for that matter, you know, washing your hands with the regular hot water. If let's say there is you touched something and the virus is on your hands, and you wash it just with a simple hot water, it gets washed off. It's not going to get stick to your skin and stay there. And you use soap, it is even better, because soap works on the lipoprotein membrane, and it breaks the membrane. Once the membrane breaks, you know, there is no way virus is going to infect you. It becomes immediately inactive. So washing our vegetables or even fruits before we eat, which we are supposed to do anyway, is a good advice.
థ్యాంక్ యూ డాక్టర్ గారు. ఇంకో క్వశ్చన్ ఏంటంటే, ఇప్పుడు స్టమక్లో ఎంటర్ అయితే వైరస్, స్టమక్ యాసిడ్స్ ఆ వైరస్ని చంపేస్తాయి అనేది ఒక ఒపీనియన్ ఉంది.
రైట్.
సో అప్పుడు మనకి యూరిన్ కానీ స్టూల్ కానీ ఎట్లా ఇన్ఫెక్ట్ అవుతుంది, క్యారియర్స్ ఎట్లా అవుతాయి?
Well, see, yes, you know, the thing is, the acid in the stomach, the pH can be as low as 2 to 3, which is a very acidic. Hydrochloric acid, hydrogen, H2SO4 అంటాం కదా మనం, hydrogen sulfuric acid, hydrosulfuric acid. వాటికంటే ఆ రేంజ్లో కంటే కూడా ఇంకా ఎక్కువ acidic కంటెంట్ ఉంటుంది స్టమక్లో. Any of the things, any viral particle going into the stomach, once it comes in contact with the acid, it is going to kill the virus or makes it render it inactive. But the thing is, it can get infected even before, person can get infected even before you get into the stomach. It can get infected in the throat or the mouth or in the nose, or even through the eyes. We knew that, you know, it can infect the eye, conjunctiva and everything. So people get infected before the virus gets in. That is number one. And once they get infected, virus goes into the cell, it gets replicated. Once it's get replicated, it kills the cell and releases into the bloodstream. It is not just like a food particle going into your stomach and going into intestines and infecting your intestine. It comes through the bloodstream and then start, you know, in some people it gets like it is affecting the stomach, the intestines more. In some people it is affecting the lungs more, and in some people it is attacking the blood, RBC, red blood cells, where there is a hemoglobin molecule. We know that, right? Red blood cells have the hemoglobin molecule. What this virus does is like a carbon monoxide poisoning. Carbon monoxide poisoning, it goes and gets attached to the hemoglobin and makes hemoglobin incapable of carrying the oxygen. So as long as that hemoglobin is attached to that carbon monoxide, it cannot carry the oxygen. Even though you are giving a lot of oxygen to these patients, it cannot be delivered to your brain, heart, and the tissues. So the people will suffer like a serious consequences with that. On a similar lines, viral particle is going into hemoglobin, and on the heme porphyrin chain, there is an iron molecule in it. It knocks the iron molecule off. When it knocks the iron molecule off, the hemoglobin loses its capacity to hold the oxygen. So even though your hemoglobin content is good, it is becoming ineffective.
So you are breathing oxygen, people are getting intubated and putting on the ventilators and giving 100% oxygen, but that oxygen is there only in the lungs. There is no carrier for that oxygen to carry from there to the heart, to the brain, to the kidneys, and to the muscles, and to other organs. That is why people are suffering so much. We learned in like last 2 weeks, what we are doing is not treating some of the patients, not everybody, some of the patients, because the mechanism is different. It is presenting differently in each individual patients. The other way of presentation is virus goes into the lungs and then attacks type 2 pneumocytes, which we call it, which produces surfactant, meaning the chemical which makes the lungs keep open. Once these type 2 pneumocytes get infected and damaged by the virus, that surfactant is not produced. Once that is not produced, lungs cannot keep themselves open. They collapse. The micro sacs, which we call it alveoli, they collapse. Once they collapse, you cannot oxygenate this person. And that is where, SARS, severe acute respiratory disease, or syndrome, or ARDS, acute respiratory disease pattern is going to be seen. Those are some of the people where they can get benefited with some of the standard treatment protocols. So this virus is behaving differently in individual patients. So that is why we need to be very, very careful and have the full knowledge about what is this particular patient compared to the right next patient, and then design your treatment accordingly. It is not a protocolized treatment which is going to work for everybody. That is why I was saying it is nothing like I have ever seen.
Thanks, Bharath garu. The next question I have is what temperature can kill virus?
See, the thing is, I would like to say the boiling temperature will kill the virus, but can we achieve the boiling temperature 100 degrees centigrade? We cannot. So there is no particular thing. The way the virus is killed is the lifespan of the virus has to go. So you keep increasing the temperature, it goes down. There was one, basic science study experiment, which is shown that once the temperature reaches 74 degrees centigrade, the virus, 100% killed. So it's, that's somebody reported. Can the virus be killed even before that? I think so. It is not 100% of the virus you need to kill. That is the principle. If you get one viral particle, can you get infected with that virus? Possibility is very less. If that is the case, just imagine one patient in entire city just sneezing 10 times. That's it with 1 hour gap. If he has one sneeze every 1 hour in a city and the air is going and there are aerosols, everybody should get infected. So to tell you the truth, there is no particular temperature where we say that, okay, virus is killed. Probably these virus 100% get killed in the case of temperatures which we don't try to, which we cannot acquire in our house. We cannot put 35 degrees centigrade in the temperature settings at house. So that question is ruled out. And for that matter, any of the edibles or anything which we bring in, we cannot heat them up. We can only wash them. So.
Thank you very much, Dr. Garu. My next question is around hydrochloroquine. So it was said that hydrochloroquine is a stable medicine without many side effects. One of the benefits of this medicine is it increases the zinc absorption. So with zinc supplements, along with the vitamin D and C, reduces the chance of sticking the virus to cells. So being said this, can the medicine be prescribed to mass public?
That's an interesting concept. So that's what I have been advising for last, this is the 10th week I've been saying that.
people should, like, at least frontliners, the people at risk should, all of them get the prophylaxis, okay, meaning take the medication before it comes. So it is a prophylaxis dose is like much smaller, and that prevents the expected to prevent the infection. But in our countries where we live, the Food and Drug Administration has to look at the safety of it. It has to be studied, and it has to be approved. It takes time. Randomized clinical trials takes time, a year sometimes. So that is why it is not been approved or recommended by FDA yet. But FDA, there are at least two centers which are studying this, meaning like as a research, randomized control trial, Henry Ford and University of Minnesota. You get half of them get the hydroxychloroquine, half of them don't get it, and there are different doses and its protocol. So the results of that is going to determine, okay, once they get published, then have to go to the FDA approval. Once it goes to the FDA approval, that's when they think about approving it, okay? But other than that, on a humanitarian ground, on a general principle, this is my opinion only. No data to support this or anything. And my logic, I'll explain you, but let me explain what I recommend. I recommend taking hydroxychloroquine once a week for all the frontliners. Okay. The only fear of the hydroxychloroquine is cardiac toxicity. Everybody talk about it, but the QT prolongation, what they call it, it is reported in less than 4% of the cases. There are many other medications we use on a daily basis on these cardiac patients, which does the same thing. They prolong the QT prolongation, QT interval. They does the QT prolongation. They have been approved, and this QT prolongation is also possible with the hydroxychloroquine. Is it too much dangerous? In some people who already have the QT prolongation from some other reason, and in people who are on the medications which already prolongs the QT, this can be a problematic. But in a normal person with no G6PD deficiency, taking 400 milligrams or 200 milligrams for that matter every week, I don't think is a major problem. And a French study which shows that more than 1,000 people received the medication. There are very few side effects, and especially the cardiac toxicity, what they call is very less. It's not that much. So I don't think there any major concern about the side effect profile of the drug. So recommend that. And for general people, if they want to take the hydroxychloroquine as a prophylaxis, it is up to them. I don't recommend it is needed for the non-frontline guys. But taking a zinc supplement, it's not going to hurt. And there is a concept that zinc can go into the cell if you're given in excess. And hydroxychloroquine actually is an ionophore, meaning it drives more zinc into the cell. And the zinc goes into RNA polymerase or RNA replicase, and it prevents the replication of the virus inside the cell. Thereby, it accentuates. Is a reasonable thought that people can take zinc supplement, but don't overdo anything. Even there are reports that people have a zinc poisoning. There are reports that turmeric poisoning, even excessive turmeric, taking a lot of curcumin or turmeric is going to cause liver toxicity. Not too long ago, it has been reported, and we know that for the fact, anything in excess is not good. So you want to take some zinc, it is advised, it is okay. Take some multivitamin, it is okay. And taking vitamin D is an interesting concept. There were studies which I came across, not just now, but in the past, that vitamin D
raises your immunity levels, natural immunity levels, and it also makes your antioxidants available more, which has been studied. And one of my classmates strongly advocates for it. It is it's not going to hurt you by taking extra vitamin D in this time of crisis. And vitamin C, naturally we take vitamin C products. We take lime, lemon, or orange juice. Any of these you can take it. Taking too much excessive vitamin C, I don't think is needed. It is not necessarily an immune booster, but maybe probably it gives a lot of antioxidants. That way it is good too. And on top of that, any of these things, zinc, ginger or garlic, or a pinch of turmeric, drinking orange juice, and using cinnamon. Cinnamon has a good antibacterial property, not antiviral, but it's a masala, Indian masala. Use masala. I think it is you don't go wrong. You eat tasty food, and at the same time you doing what a lot of people are proposing out there. And coming back to hydroxychloroquine, so I already said it works in 2 stages. One before the symptoms get too severe, and 2 after the symptoms get too severe. And it works by 4 mechanisms. I was saying this, right? 2 mechanisms we know from SARS from 2002, the sister virus. And then we came to know the 3rd one, and now people are saying there is a 4th mechanism. So where the hydroxychloroquine works, very interesting concept is, one, we already know that it is an ionophore, which I said. It drives the zinc into the cell, thereby potentiating the zinc effect, number 1. Number 2, it glycosylates the receptor. Where the virus goes and attaches to the cell, it glycosylates. So the number of receptors available for this virus is less. So the chances of getting infection is less. And the 3rd is, it is going to prevent the RNA replicase and in the ribosome polymerase enzyme. Thereby, the number of viral copies produced by the cell are going to be significantly reduced. And it also, by driving the zinc in, it increases the pH of the endosomes inside the cell. These are all the medical concepts I'm saying, because someone clearly came up with the medical jargon there in their question. So the last one is the most important, where the hydroxychloroquine works in the 2nd stage, like once the disease advances, is it's not going to work in everybody. It is going to work in the people where the iron molecule is removed from the hemoglobin. The virus goes in there, knocks the virus off the hemoglobin. So that is the very interesting thing. Virus prevents the hydroxychloroquine prevents the virus from removing the iron molecule, iron ion from the hemoglobin. We call it a iron hemoglobin dissociation. So it prevents the dissociation. That is where it is going to be really helpful. But once the disease is already progressed, all the hemoglobin is already lost the iron, you give the hydroxychloroquine, it is not going to work. So when we look at the studies, in fact, there were a couple of studies came in showing that hydroxychloroquine is not going to work. But the thing is, what they did is very smartly, they picked up only the people who are have a very advanced symptoms. The game is already over. And the game is already over when you have to make 46 runs out of 1 over. It's not going to happen. Whether it is Virat Kohli or Sachin Tendulkar or Chris Gale or anybody, they're not going to make those runs. It's the same thing for hydroxychloroquine. It does not work in 100% of the patients. It works in good number of patients. It works much better if given early in the disease process.
Thank you very much, Dr. Bharath. The next question, before I go to next question, just to reiterate, so this is only for information purpose. If you want to do any action or do any preventive thing, please consult, discuss with your family doctor. Bharath Garu, the next question is around families or anyone in the family showing symptoms of coronavirus infection. So, apart from consulting the physician as a family doctor, do you recommend anything in between? Or like, what is your recommendation on this part?
So the thing is, if someone has a doubt about the corona, they have to run to the testing center. That's the first thing they have to do. Instead of doing anything else, run to the testing center, get it tested. And now there are rapid tests, which are like the results are out in like within hours, 2 hours. You know whether you have it or not within 2 to 3 hours, not like taking 5 days, 7 days, like a month ago. So first thing you do is you go there. Second thing you do is you isolate yourself until you know the results. And before that, you call your doctor. Or in even the testing centers where the testing is done, a lot of the hospitals, they have the drive-through testing centers. You go there, you get tested. If you have like a symptoms enough, they give you the presumptive treatment and then send you home. Or they admit you if it required, any shortness of breath or anything like that, they are going to admit you into the hospital after testing. So there is a protocol for everything. So when you have a doubt, go get tested. This disease is not worth to wait on it. You never know in that stages of this disease, where you end up, nobody knows. People like, that 13-year-old teenager who got infected had symptoms 4 or 5 days. What they thought is like, oh, kids won't get it, and this is not COVID. And then finally, she collapsed and was taken to the ICU, got tested positive for COVID. But the unfortunate situation is the symptoms have progressed already. So once the symptoms progress to stage 3, for that matter, now we are trying to define stage 4 also into this disease, changing into 4 different stages. It's a developing thing. So anything what I say is true for today, until today, and it changes tomorrow. But one thing for sure, if you have any doubt about having a COVID symptom, just go to the hospital and get tested. It's not worth it. It's not worth it. Worst case scenario, you get tested, you will be told you don't have it, which is good. The better thing is you get tested positive, you get treatment.
Thank you, Dr. Bharath. So the next question is around antibodies testing. The question is, the government should focus on getting the people tested for antibodies to know how many people are immune. So is this a good approach? And someone was asking about antibody test by Abbott, ABBOT, available for all or not?
It is not. That is what is eventually going to happen. I think I already answered this question, but I'm happy to answer again. So that's how the phase-wise manner of lifting the lockdown. Okay, people will start getting antibody tests. It will start with the frontliners first, and more critical services. Military, cops, and all these they should get tested first. And once they know that they have the antibodies, it is much more easier for them to get to their regular activities, which are like more needed, more than the hospital. If the lockdown continues for too long, there will be, and then we'll start seeing the secondary effects of lockdown. A lot of people have guns, and if you take out their livelihood, God knows what will happen. And I hope it doesn't. But we can't keep it locked down for forever. People need to live. Once it comes to a stage where someone is like struggling for their livelihood, things will change drastically. So there has to be a community test of antibodies, and everybody should get tested, and the people should be allowed to go back to their normalcy in a phase-wise manner. There is no other way around it. We have to come out. How long are we going to stay home? You know, now you can't ask the people to like lock themselves down. And we're not dealing with the disease with like a 10%, 15% mortality. We are like, now the mortality is even less than 1%. If you consider all the people who are like out there like getting tested and not getting even into the hospital. So that is why I want you guys to understand even more about when you're looking at the numbers being reported and quoted by these people. I'm like even surprised, some of the people go on to TV and talk about like how the numbers are rising. How everybody is like making people more panic when it is not needed. There is no doubt we got to be extra careful about this disease, because this is not a simple disease. It's a deadly virus, deadly disease. But at the same time, don't feed more fear into the people than which is already needed, which is already in there and which is not needed anymore. And because I'm saying that, let me show you a couple things up here. Slides, the number of daily reported cases and stuff like that. Okay, what we are seeing here is, the number of deaths. I'm comparing like, the confirmed COVID-19 deaths, United States and Canada. Oh, you guys have not shared. 1 second. Sorry, guys. Yeah. You see that?
Yes.
Can you see that slide?
Yeah.
You see that United States, we started like, I usually show it like over a period of 1 month. See the curve, like how it is going. The deaths keep rising because there are still sick people out there. Okay. And the people, we are like trying to, like the people who get sick, get confirmed today with the COVID test, don't get sick and die today. It is going to happen like a week or 2 weeks later. So that is why when you're seeing United States, you see that like a quick uptick right around here. Okay, that's where like, April, about 10 days ago or something, April 9th, 10th, somewhere. And about 2 weeks ago, prior to that, and 1 week ago, this is where the uptick is. And then instead of going just like this, it is coming up like that. And same thing, Canada is much less affected at this point of a time, but still considerable. It is not like negligible. So same thing up here, the cases and the deaths. These are the deaths. This is the cases. Okay. And let me show you the next one, the total daily cases. You guys see the change in slide or the same slide you seeing?
For some of us, the screen is frozen.
Okay, let me share it again. Okay. Okay, you guys saw that thing, right? Now this is the total daily reported cases. Look at it. How this is Canada. The blue line is Canada, and the above is, United States. This is a daily new confirmed. These are the deaths. You see that, how this is happening, and you saw uptick and went down here, and the curve is like this. Whereas you see the curve like number of cases, it keeps going. These are per day cases. Every day, how many they are reported. So now what is happening around here is, these are the number of confirmed cases, but majority of them are having mild symptoms. They're not having as many symptoms as before. The reason is, it is not that the disease virus has changed its presentation or anything. The difference is the availability of the testing. Now we are testing more and more people, and the testing is available for the people who are with the least symptoms. Even sometimes when you go there, you don't even have the symptoms. You don't even qualify. You say that you had some symptoms in the past, they're going to do the test. So when somebody with a minor symptom goes there and get tested, comes back positive, is going to count towards the positive COVID case, which wasn't possible like 2 weeks ago. So when you look at these number of cases turning positive, you may see the rise. because we are checking more people. We are checking less severe symptoms, people with the less severe symptoms. That is what is happening. And then not many of these people are getting admitted. So admission ratio, which I monitor, very closely. I can talk for the state, not for the whole country. The admission ratio was way higher. It used to be almost like a 40 to 70% in the beginning, depending on the hospitals. The moment somebody gets tested, used to get admitted. The reason for that is very simple, because these guys, were not a normal person or a mild person with the mild symptoms were getting tested. Only the people with the very severe symptoms were getting tested. So the admission ratio was much higher. And at the same time, because the admissions were for the sicker people, then more percentage of the deaths were happening. So when you look at the mortality, it was higher. When you look at the hospital admission ratio, it was higher. Hospital admission ratio has come down. The mortality has come down. At the same time, the daily COVID reported cases are going to go up. There is no doubt about it. So people have to be very careful in interpreting all this data. See, there was so much of a stuff like thrown out into the web every day, and so much of people it's a good thing. People are trying to educate one and everybody using their social media, ways. But the thing is, when you look at the numbers, take it, interpret it with a bit of doubt or bit of more knowledge. So numbers are going to go up, deaths are going to decrease. We have seen, I think we have seen the worst, but having said that, it's not over yet. The reason why I say is a lot of people I don't think there are a good number of people who are not infected with this virus. There are a good number of people who have the virus and transmitting the virus out there. So when you go out there, still use the precautions, be careful, and don't take it easy. And the other major thing here is United States is not just one country. It's a conglomerate of so many states. So what we saw is a initial rise in Washington and California, and they instituted the lockdown way early, and they controlled it nicely. The number of deaths or number of cases. And then California, even the weather favored. And for the southern states, weather is definitely favored the transmission rate. But it is not going to prevent them from getting infected. It's going to come up. And at the same time, the worst is over for New York and New Jersey, it seems, at least from the numbers I'm seeing. And lately, the Boston picked up, and Illinois picked up, and Nevada, Arizona picked up. And it seems that the Dallas is going to pick up some more, Texas is going to pick up some more cases, but not the rate. Rate is not going to go up significantly, but number of cases, we are going to see a surge in them, and so is the South. And that is why it is very, very difficult when we say that. And another interesting factor is, I think the virus spread is a bit interesting. And if the country is too cold, virus is not spreading as much as it is in a moderate zone. If the temperature is too high, definitely the virus survivability is going down, and the rate of viral infection is less. But at the same time, if the temperature is too low, below 30, or whatever the Fahrenheit you want to say, near the freezing temperatures, probably those countries are also not getting affected much. The reason for that could be whatever the droplets are freezing immediately, and the virus is not able to survive on them, or the aerosol lifespan. It is interesting to see what is the viral survivability in the aerosols with the different temperatures. I think someone is looking at it as we are speaking, and we will know when the data is out there. That is why even the Canada, it didn't see that much of it. One of the reasons why Canada didn't see so many of those cases is because probably, the temperatures are on a lower side, number one. Number two, the population density is lower too. It's not as high as some of the cities which were worse affected. The worst affected city by far is the New York City. And the New York City, we know the density of the population is so much higher. There is so much diversity. And also at the same time, there is so much of a public use of the subways, wherever the train system, and wherever this is overcrowding of the public transport system. I think those are the places where infection is spread in a much rapid pace.
Thank you very much, Dr. Garu, for all the valuable information. I think the next set of questions you already covered. The answers are already covered from your conversation, from other questions. So it's been like more than 2 hours, and thank you very much from our bottom of our hearts for spending your valuable time explaining us, giving a lot of valuable information. We really, it's very helpful and useful information. And we are also proud that our fellow Telangana Telugu person is in the frontliner and battling the beast on behalf of all of us. And we are proud of you, Dr. Garu. So have you got any concluding message for us before we wrap up?
Yeah, sure. Thank you, Pawan and TDF Canada, and thank you other social organizations which helped me get into it to do this thing. This is the least I can do. I'm spending so much time for so many weeks. Actually, I started warning people as early as January 27th. People made fun of me, still people are making fun of me sometimes when I say some of the things which are not out there, but that's okay. But since I knew more information than so many other, I'm on multiple fronts, not just on the doctor side. I'm also looking on the administration side. I'm also on the coalition side and disaster recovery side and everything. So a lot of information comes to me. I feel it is my minimum. It's the least I can do. That's my job and my responsibility to bring some of the knowledge to the community. That's why I'm doing this, and I'm happy to do this. And thank you very much for all your time. But my sincere request, it's not over yet. Advise caution. Don't take anything easy, any of the advices given by the physicians or the CDC or any recommendations. Be careful, be safe, and don't stockpile all these masks and everything, which are at most needed for the healthcare workers and other frontline people. There are so many people stockpiled these masks and everything, which is inhumane, and put so many people, so many healthcare workers at risk. There are thousands and thousands of healthcare workers trying to take care of patients got infected, and unfortunately there is not a lot of support, and the communities need to show some sympathy and empathy to these people. And the ironic thing is people have even furloughed the healthcare workers, and some of the hospitals are even asking people to take a pay cut while working more and risking more than before. They are getting subjected. It is a huge emotional trauma on some of the healthcare staff. Probably not for the doctors. Everybody thinks doctors make a lot of money. So, but other people, there are a lot of people who work for way less than what you guys even think. Most of the audience here are like into the IT industry, I'm pretty sure, or at least their loved ones are in the IT industry. When you look at it, they make way less than what we make as IT engineers, and they are being punished for taking the risk. This is not humane. I don't know what's the solution for that. At least, like, you know, I request you guys to show some sympathy, empathy on these guys, and support them in the whatever the way you can. That's my request. And don't stockpile on masks and all these things. That's more needed for the healthcare workers.
One last question from my side, Dr. Garu. We talked about preventing, curing, and precautions, but we did not touch the source. The source for this virus and source for the previous virus, and what lessons we learned from the current situation, and what we need to be, how the lessons will be helpful in the future, how we need to tackle this, because it's a global thing, not specific to a country.
The thing is, it's a very cryptic question, you know, to answer that. A lot of theories there, you know, China made it, and there are theories there, America made it. And, you know, wherever it is made, you know, none of the countries or none of the people are idiots to release it into the market, you know, without the cure. If China made it, they are not idiots to release that into their own country without the cure. And we already knowing the numbers, you know, the numbers they reported itself is like horrendous numbers, you know, it's like a scary. And people are saying that there is 10 times more. I don't forget all that, you know, even like 80,000 people affected, Wuhan, like, which is a industrial backbone of China, like, was shut down for like 6, 8, 9, 10 weeks. It's not a simple thing for any country to experiment on anything what they have. And so for the same thing, if America made it, let it in China, America is not a fool. We are not fools to, like, you know, leave the virus in China and thinking that only it affects Chinese and it will not come back to America. No, I don't think it is man-made. It is not done with a mal-intention or anything. But having said that, does the experiments happen on these coronaviruses? Yes, because it's a matter of a time where we are going to see a way worse virus than what this is. I can write you on anything and give it to you. In the next few years, we are going to encounter a much deadly virus than this. There is no doubt about it. The way we are acting, the way the humans are behaving, it is not like it will not surprise me if I see that in the next few years. Okay, so to combat that, you know, to well prepare for all these things, every country, advanced nation with the advanced labs and virology institutions, they keep studying it. You know, keep studying it. What happens if this virus? What happens? Imagine just a flu virus acquires like a virulence of Ebola virus or Nipah virus for that matter. You know, 80% of the population, and Nipah, we estimated 68 to 87% mortality. Ebola, 40 to 50% mortality. Imagine if these viruses mutate just like that and acquire that viremia, the game over, guys, game over for us. So to combat this, you know, all the labs in the world, they keep experimenting on it. Did it leak accidentally anywhere, either in China or anywhere? It is a possibility, but any virology institute is not going to have just a simple check where somebody can like get the virus on the finger and take it outside. No, it won't happen like that. They have like a multi-level security protocols. For that matter, CDC has level 1, 2, 3, 4, 5 security systems. You know, more dangerous viruses get like, you know, higher grade of security. I don't think it is a willful act. I seriously condemn that, whoever says that. And is it possible that the virus accidentally leaked from the lab? Chances are very slim, possible. In my opinion, I think the virus is a natural mutation. Natural mutation between the bat virus which is in the bat. So that is why Indian culture and customs, what is our customs and customs say? Hinduism teaches that if a bat enters your house,
Leave the house for like a month and then clean up, do a deep cleaning and then come back. Haven't you guys heard that? All of us heard that. And in fact, there was one time, the bat come into our house and we did the deep cleaning and left the house for a week. So we knew there is a lot of viruses in bats, and we knew that the bats, we are not supposed to go near the bats if we catch the virus, and if the virus mutates, and it is going to kill a lot of people. And unfortunately, in a wet market, the bat is brought next to the what is that animal called? It's a funny name. Some starts with P, and it might have mutated the virus of that, and formed this novel coronavirus. And it has happened in the past. SARS virus happened in the same way. It mutated with something and then came up. All it takes is one virus coming in contact. It's a right conditions at the right time, and the virus is in the right place. That's all it matters. And it can happen anywhere, and it can infect anybody. So the worst is not over. Be careful, take care, be safe, be considerate. In spite of so much of a havoc and the fear inculcated into the societies, there are a lot of people out there. I don't think they have realized how fragile our lives are. People are just dying in a matter of 3 days. Completely normal, healthy person dying in 3 days. And if you happen to be associated with that person, how much fear or emotional trauma it inculcates into you, it's unimaginable. And I've seen it not once.
Thank you very much, Dr. Garu. Thanks again for your valuable time. Thank you. Stay safe. And once again, we are proud of you. Thank you, everybody, for attending. Thank you.
Thank you, guys. Take care.
Bye-bye.
Yeah, thanks. Yeah.